Welcome to Taking Care of Lady Business, where we put the business back in lady business. Hosted by Jennifer Justice, founder and CEO of the Justice Department, a management strategy and law firm that works with female and woke male entrepreneurs, executives, talent, brands, and creatives to build and maximize their wealth, focusing in the areas of tech, consumer product, finance, media, entertainment, and fashion. Jennifer interviews entrepreneurial women who have done it all, who will be sharing their secrets on all things business, especially as a woman. These highly successful women will share strategies and insights, including what not to do and what it takes to win. And now, here's your host, Jennifer Justice.
Hi, this is JJ, the host of this podcast, Taking Care of Lady Business. If you're here, you know my passion for making women rich. Did you know that men are 4 times more likely than women to negotiate their compensation packages? And that women are leaving about $1.5 million on the table by the time they're 60 by not negotiating? That's a lot of money, and I want it to stop. So I'm launching a course called Be the Boss of Your Career to show you how to get what you deserve. Our first live session is May 3rd, so go to www.thejusticedept.com to sign up for more information. I look forward to seeing you there and helping you get rich. Thanks to MedJet for supporting the Lady Business podcast. If you're hospitalized or your security is threatened while traveling, they can get you home. I'm a MedJet member and have been for years. Everyone who travels should be. Enroll before your next trip at medjet.com. Hello, everyone. Welcome to this episode of Taking Care of Lady Business. I am Jennifer Justice. Today, we have the brilliant Dr. Piraye Yurttas Beim. She's the founder and CEO of Celmatix, and your minds are going to be blown when you hear what she's A, doing, and B, how she's trying to, well, she's not trying, she is helping women in their fertility journeys, as well as just in femtech entirely. So welcome to the podcast today. It's good to have you.
Thank you.
I am excited to get in on this because, I mean, not only is your journey as a founder interesting, which we're going to get into, but what you're doing now as a scientist and for women's health is just incredible. So I want to dive right in onto that, and by asking you, like, what is Celmatix?
So Celmatix we're a drug company focused uniquely on developing drugs for conditions that either uniquely impact female bodies or disproportionately impact female bodies.
And why is that important?
That's important because intuitively women know when they go to the doctor, they don't get great answers. And even if they get an answer, they don't get a great solution. But what a lot of people don't know is that what underlies the fact that there aren't great tools in the toolbox at the OBGYN or at the GP is that we really haven't fundamentally brought a new drug specifically made for the female body forward in about 100 years.
That's insanity.
Right? It is pretty insane.
Okay. And why is that though? Why wasn't anything done in so long?
So there's so many reasons. I think that first of all, we normalize female suffering and pain. We also normalize menopause, which is when a key female organ, the ovary, stops working in midlife. We normalize the fact that for 30% of women, their ovary never really is healthy and never really works in an optimal way. And so part of it is that we've just accepted poor health outcomes for women. The other reason is that women outlive men statistically by a couple of years. So I think there's this perception, well, women are surviving longer than they've ever survived before. What could be the problem? But I think there's a key difference between women surviving longer than they've ever survived and women thriving. And I think that that's the gap we want to close. We want to close the thriving gap because we say men age like a fine wine and women fall off a cliff. And biologically speaking, there are things that underlie that. And we want women to age like a fine wine as well.
And so that's including everything internally, not just externally and your skin, et cetera, right?
That's right. It's all interconnected. I think we realize what's happening externally, and we're very focused on that, of course. But what we don't realize is that when we start to get dry hair or dry skin or wrinkles or these external signs of aging, we don't understand all the aging that's happening on the inside. Mm-hmm. And for us, it's about supporting women to thrive and be as healthy as they can throughout their entire lifespan. I think that's so critical. And by the way, everyone should care about this. This is not really women's health, it's human health, because I have to remind people that we gestate 100% of all humans. So every human has lived in a woman's body for at least 9 months of their life. Like every human was a woman for a period of time. And so what happens in our bodies impacts the entire planet. And also women are increasingly becoming, or the fastest growing, demographic for the military. So female soldiers, that's where they're pulling from, recruiting women in numbers like never before. In the workplace, we have more women who are in the workplace, and not just more women, but more women who are past the age of menopause. So we have more postmenopausal women in the workforce than ever before. And so even if you don't care and you think, well, women are healthy enough, it's fine. You should, if you're an employer. You should, if you care about the economy. You should, if you're a human being, basically.
Well, yes, we know that. Unfortunately, some politicians don't really agree with us,
Right.
Mostly in Alabama and those, other southern states. But yeah, we can go on that. So tell me more. I mean, I've read a bunch of the articles. A lot of it goes over my head because you're science, like all the science and et cetera. But generally, what are the drugs that you are working on that are like groundbreaking right now?
So we've got a number of drug programs in the pipeline. The ones that we've announced are, one is a drug designed to make menopause a choice and not an inevitability for women.
So you would be able to have children like your entire life?
No.
Okay.
So this is a distinction. I'm so glad you asked that question, because I think that's the most common question I get. So you want women to be having babies at 89?
Because there's a lot of us who are done.
Regardless. I hear you. And this hits on one of the biggest misconceptions about the ovary, which is what this drug is focused on, extending the function of. So the ovary is seen as this egg factory. And that makes sense because you think of the word ovary, it comes from the root of ovum, which is egg. So ovary means home of the egg. So we think of the ovary as this sweet little home that the eggs live in. In reality, reproduction, egg production is one of a huge laundry list of functions that the ovary has. And if we compare it to the equivalent organ in males, which is the testes, the root of the word testes is testament or truth, vitality. So for millennia, since the beginning of language, we have acknowledged that the testes are a source of vitality and health for men, even before we knew that it was a source of fur. And yet for women, it's the equivalent organ. It is also a very vital organ. It's not just a reproductive organ. It's involved in our immune function, in regulating our metabolism, in regulating our brain health. Virtually every aspect of our health is impacted by ovarian function. And 100 years ago, the average woman's life expectancy was early 40s.
Yeah.
You and I are like way over the hill for evolutionarily speaking. The chances are we wouldn't be around. So ovaries stop functioning altogether pretty much on average at about the age of 50 to 52. And so demographically speaking, menopause, when the ovary stops working, is a modern phenomenon because women just didn't live long enough to go into menopause in large numbers. Yes, menopause has been around as a concept since the biblical times. It's been written about, but it just was super rare. And then, antibiotics, for example, people don't realize the scientific discovery that led to antibiotics was in 1929. And we didn't really have antibiotics until the 1940s or 50s. So what we had was these incredible health breakthroughs last century that enabled women to survive, not just past the age where this key organ stops working, but decades past it.
Right.
Decades. And there's this feeling of like, well, I don't want to have babies anymore, and I'll just take estrogen and progesterone, and we can talk about HRT if you want. But estrogen and progesterone, which is HRT, and you can add that back, it's the tip of the iceberg. The ovary also makes testosterone. That's a misnomer. We should call it testosterone.
Yeah.
We make it too. The ovary makes dozens and dozens of things that regulate all these processes. And so women just think, again, because we normalize female suffering and we stigmatize it and we don't talk about it, but they just assume that as their sleep quality declines, as their as they get to a place where like, I can't have that glass of wine with dinner anymore. I feel trashed the next day. I can't keep the weight off. I don't have the energy. I don't have the mental clarity. I can't remember things like I used to. My sex drive is different. All these things are changing. Women assume it's just aging. And they don't realize that a vital organ in their body is no longer working and is accelerating aging in a really dramatic way. So for us, we want women to age well. I'm not anti-aging. I think aging is awesome. I love being older.
Yeah.
But what I don't love is all the ways that my body is letting me down as I get older. It's not just about reproduction.
Yeah, exactly. I love that. That explanation is, it's amazing. So you want women before they get into menopause to start taking care. This drug will help them take care of their ovaries. So, but once you hit menopause, then how do you take care of your ovaries?
Well, so ovarian function significantly declines after menopause. And so you have other sources of estrogen in your body, but not the same. The other thing is estrogen is a misnomer. There are estrogens. There are multiple types of estrogen. And so HRT also just addresses one type of estrogen, which is the predominant type that the ovary produces. But there are, you basically have to manage it with lifestyle. So because your sleep quality is declining, you have to control what you can control. You can't control the fact that your ovary is not working anymore. But what you can do is make sure you're getting natural light exposure during the day. Make sure you're sleeping in absolute dark at night. Make sure you're not doom scrolling in bed and destroying your melatonin signaling pathway. So you really have to develop good sleep habits and over-index on the lifestyle piece because your body is not as good at doing it on its own anymore. So you really have to encourage the biology. I think with respect to the immune system starts aging precipitously at menopause. And you start to move into kind of a more pro-inflammatory state. Yeah. And so you have to manage it with diet. You can't eat the same things after menopause that you ate before menopause because your body is going to hyper respond to environmental things that inflame you, to stress. And so you have to control what you can control, which is your diet. And by the way, I don't want women to have to live like that. I want to actually fix the underlying problem.
Yeah.
It's fun to be in your 20s and eat whatever you want and stay out all night and bounce back and have a productive day at work the next day. Why should we accept that at midlife we have to now control all of these factors when we can actually solve the root problem? And so that's what we're working on.
I love it. Amazing. And then I was reading also some quotes of you were saying about IVF we were talking about. And obviously we want IVF to stay around forever because there's people like me who had kids by myself and you need IVF and same-sex couples, etc. But you said something interesting about the injections that we're taking and only women are taking them. You're saying something about men could take them actually?
Yeah, so that's another misconception. So the other drug program that we've announced is an oral FSH program. And what that means is the classic fertility drugs that everybody thinks about that you have to inject yourself with, we could replace with a simple pill. Mm-hmm. And that would be a game changer for a number of reasons. So first of all, you named a couple of stakeholders who benefit tremendously from IVF. But when I started Celmatix in 2009, the statistics were one in about maybe 15%, 1 in 15 couples or individuals struggled to get pregnant. Now it's closer to like 1 in 7. I mean, it's just the infertility rates have really, really skyrocketed globally. It's not just in the United States. And so increasingly, IVF is becoming the fundamental way that people are starting and expanding their families. So this is not a nice to have. This is a must have for a plethora of people. And as we see more and more people relying on IVF, one of the challenges is the burden of care. So the burden is disproportionately on women. Mm-hmm. And I have to give a sperm sample, which they're usually okay with. Yeah. I don't want to minimize the burden. It's hard for a man to go through infertility too, but I think no one would argue that really the burden disproportionately falls on the female who's going through it. She has to go in for daily monitoring. She has to undergo all of these injections. These injections come with a risk. So you can develop a life-threatening complication of injecting yourself with those hormones. And as more younger women, so as younger and younger women are exposed to these injectable fertility drugs, we're seeing more issues. You talk to women who have gone in for egg freezing and they've had to inject themselves. These are drugs that were developed for people with infertility. Now people without infertility are taking it. They've got these ovaries that are chock full of eggs, and they hyper respond to these drugs, and they end up hospitalized with a life-threatening condition. And so we need to make these drugs safer. We need to make the burden of taking these drugs easier. And so the oral medication will accomplish that for a couple of different reasons. But the point that you started with was that what people don't realize is that a lot of infertility could be treated not with IVF and having a woman have to undergo all of these treatments, but actually by giving FSH injections to the male and improving his sperm quality and count. And then he can get pregnant at home.
Yeah.
He get his partner pregnant at home. And in Europe, they do treat male infertility with FSH injections, but they have to take many of them. So it's for months and months. So it takes about 90 days to make a sperm. And so you have to inject yourself for about 3 months before you see an impact on your sperm quality. And in the US, the pharma companies won't even try to market it to men.
Oh
They
my
don't give it a
God.
shot because there's just this belief that no man is going to inject himself for 90 days when his wife could just go get IVF. I actually think that's not true. I think we're underestimating the willingness of men to step up to the plate, but certainly once it's a simple oral pill that they can just take a pill a day, we think that like a lot of guys will step up and treat their infertility rather than having their partner treated.
Yeah, I mean, it's kind of like it's like a bravado thing too. They want to know that that's not their issue. You know what I mean? Yeah, I mean, I injected myself for 9 months, so and then after you're pregnant, people forget you have to do it for progesterone for another 2 months, that one is by far the worst. Yeah, so I'm not feeling sorry for anybody who has to do, it for 90 days, but still, I mean, this is amazing, like.
Yeah. And by the way, the progesterone doesn't have to be injected. We already have the technology to eliminate progesterone injections, but we don't. Because again,
11 years ago, that would have been nice to have to do.
Exactly. We normalize female suffering. We normalize.
And I suffered a lot, but it was worth it in the end. 2 kids who are about to turn 11 years old, a boy and a girl, and it's great. But yeah, there's a lot that can be done. And the fact that nothing had really been changed for 100 years, like I think we're talking about the speculum too, the thing that you have to get, it's inserted when you're at your pap smear, your annual. You told me something like, when was that invented?
Yeah, I was curious the other day. I thought, how long have we had the speculum? Surely we can do better than this. It dates back to the Roman times.
Form of torture.
Yeah.
Thank you.
Yeah.
Oh my God. Oh, it just gets my blood boiling so much. I can't. All right. So, look, you said something which just kind of passed by. You started this company in 2009. This is before, everyone was talking about VC and female founders. That was real life from 2010 on, when this whole thing and talking about how much, how women get money, et cetera. Like, how did you have the audacity to start a company as a female in particular in healthcare and like challenging these ideas and raise money, by the way? Tell us about that.
So I've had a few people joke that we're the OG femtech because we predated the term by several years.
Yes.
To me, I came into this as a scientist. So it was a pretty simple proposition, which was that I felt that government funding in academic research. So let me take a step back. I've been innovating in women's health for over 20 years, originally as an academic scientist. So I did my PhD at Cornell's Medical School here in New York City. And then I went to the UK and did my postdoctoral work in Cambridge. And when I was coming up as an academic scientist in the US, especially in New York City at the time, in the early aughts, I just didn't have role models. I didn't know people who had started companies. If they did, it was a kind of a retirement project. They would take all the science they'd worked on and retire into some kind of company. And when I went to the UK and to Cambridge, I was meeting people who were doing groundbreaking work in the private sector through startups. And I associated startups with a young guy in a hoodie kind of Facebook type of startup.
We all do.
Right? We all did. My father's a computer scientist, and he was really early in computer science. And he progressed his career in academia. And I remember he told me once, he said, I stayed in the ivory tower. I stayed in academia because I thought that's where I could do the purest work and have the biggest impact. But as I reflect on it, I should have gone to Google, Microsoft, Apple. I should have gone to one of the tech companies because they were really the ones who were doing the most groundbreaking work in computer science. And don't close your mind to the idea that maybe the most fruitful work you can do as a scientist is in the private sector. And I was always really inspired, not by science for science's sake, but science to help people, to really have an impact in healthcare. That's why I did my PhD at a medical school. And so when I got to Cambridge, I was so inspired by people who were starting companies. And honestly, the fact that I was a woman never even occurred to me that it would be a hindrance or a barrier. Never occurred to me. I just kind of like blindly just thought, well, this will be great. I am inspired by these people. I have this idea. I had turned 30. And what I noticed when I turned 30 was that not only me, but my friends kind of flipped a switch from worrying about getting pregnant too soon to worrying about whether we could get pregnant at all, because people were getting married and having miscarriages and showing up at infertility centers. And what I realized was that we had really made strides in the laboratory in understanding fertility differences on a genetic level. And this concept of precision medicine, that you don't just treat somebody as a cookie cutter, it's not just cancer, but you really go into the cells and you say, what's going on genetically in those cells and how can I cater the treatment specifically? Or you don't just tell women they're at risk for breast cancer, but you go in and you specifically can identify within families who's at risk, who needs to be monitored and treated maybe early. And so I was just really inspired by that idea of precision medicine, personalized medicine. And so genetic sequencing, the cost of genetic sequencing when I founded the company in 2009 was like $100,000 for a whole genome. Now it's sub 1,000.
But oh my God, that's crazy.
It started off like billions, right? So 100,000 felt really cheap compared to where it had started. So it felt like if I could just tap into this energy and this desire on the part of women to know more about their bodies when they went to the doctor's office, to get those answers, and then to have more solutions. So that was really the dream of the company, was how do we leverage, at the time it was called big data, now it's called AI. It wasn't called AI because we didn't have the data sets yet to train the AIs, but it was big data. It was just building big data sets. How could we really create a female biology specific data set that would then unlock our ability to build diagnostics, digital health, and therapeutics that could really improve women's health outcomes? That was the vision, was a female specific personalized medicine company. And it wasn't only until about like a year into the process that I was like, there are no women doing this. Full stop. Just there are no women. And again, I was really spoiled. My mom did a PhD. She was a pioneer. She was the first woman to do a PhD in chemical engineering at her school, and just really broke through the barriers, and she'd go to the lab every day. It was all men. She'd have her hair, it used to be rollers in the morning. She'd have her hair perfectly done and her makeup perfectly done. And, she still had to be that ideal of like a female, but she was in the lab with like power tools, during the day, dressed like that with that hair, trying to build these huge machines to do these experiments. And so I think for me, like, it just never occurred to me. The other thing is that we immigrated here. So I immigrated here when I was 3. And I would ask my mom, who came here from Turkey, why did we come to the US? And she said, because in Turkey, women are limited in what they can do. And in America, they're not. And so when you get told that as a toddler, that story gets reinforced. Not until I actually became a CEO did I realize that women can't just do anything they want, even in America. There are some significant barriers to progress for women.
Exactly. Wow. And so how are you overcoming these barriers?
It's been incremental. I mean, in May, it will have been a 15-year journey of building this company. And it's just been so incredible to go from that first pitch deck where we envision, let's build a data set, let's understand what makes female biology unique, let's leverage it to build these products, and ultimately we're going to have new medications for women. It's so exciting to be on the last page of the deck now, 15 years later. But it's been a real journey. And I think that, one of the stories that I've told that people kind of think is funny, so I'll share, is when I first got started, I realized nobody's taking me seriously. They just see me. I'm young. I remember the first VC I ever had a call with interrupted my pitch and said, you should smile more. And this was a phone call. He couldn't see me. And I said, what? I was so like, I should smile more? He's like, yeah, I did a Google image search of you. You don't smile enough in your pictures. And I was like, what does this have to do with my business model? And so that was my very first, that's how it started. That was my very first VC pitch. And it didn't get much better from there. So I remember I walked into Bloomingdale's and I went up to the Yves Saint Laurent counter and I said to the French woman behind the counter. I said, I need you to make me look older.
Said no woman ever.
Yeah. Said no woman ever. She just said, in my multi-decade career in cosmetics, no one has ever asked me to make them look older. And I said, no one's taking me seriously. I need you to make me look older. So she gave me a smoky eye, and I had this like eyeshadow I would put on before I would pitch to try to look like more mature. But and I thought it was me. I thought I was doing something wrong. And I remember Sally Krawcheck, who I didn't know, but I knew of her. She wrote I think it was an op-ed in the New York Times. And this was years after. I mean, this is like maybe 5 years after I had been pitching and, really. And she wrote a op-ed where she described her journey. And I mean, she was a trailblazer in finance and certainly was the only woman in the room for a lot of these things. And she said it wasn't until she started a company and pitched VCs that she truly felt just the weight of sexism and the barriers to female progress. And as she described the behavior of VCs in her pitches, I actually started crying reading the article.
Yeah.
Because I just thought, it's not just me. If this is happening to Sally Krawcheck, who's my hero, if
she's
they're
on the
doing
cover of Time magazine, and they're like, isn't that cute? You're starting this little thing.
Yeah, it doesn't have to do with my age. It doesn't have to do with my style in pitching or the data on my slide. The one thing that Sally and I had in common basically was that we were female. And then after that, I think she really helped open it up. But all the data started coming out that less than 2% of capital goes to female founders. And that's when I started to realize how remarkable it was and how much we were actually beating the odds. So I felt like we were failing.
Yeah.
I started to read about the barriers. I realized, my goodness, like, we're a success story. We beat the odds. We're not failing. This is what success looks like for a female business.
I mean, but it's still heartbreaking, because just think about where your company's, I mean, you've done so much, but if you were white men, what I mean? All the money that would be handed to you, it's insanity.
And this happens. Women's health is overlooked. So women's health innovation gets less than 1% of the funding overall from pharma, from VCs, et cetera. But if you look at the math, the companies that do get money within women's health have male founders and CEOs, despite the fact that 80% of women's health companies are founded by females.
Right. It's unbelievable.
So even within women's health, the men are getting the backing, not the women.
Yeah. Well, these kinds of conversations are what slowly open up everybody's minds, and they see it, you know what I mean? And it's like what Sally was saying in that op-ed, it's like what Me Too is doing too for women in the workplace, and it's just like, when we can tell your story and everybody's like, wait, it's not just me. That's the thing that's so important to me, and why, like, I do the work I do, and why I have this podcast, so everyone can tell the story, because they have so much similar advice, And the other thing that I like, and I wanted to hit on with you as well, is that, you started, a company 15 years ago, and you've since had 3 kids, and like doing it like that, like it's all possible, it's like you're dealing with all of these, like trying to raise money and, building in an industry that, like, everyone's like, oh, that we don't really need that. You know what I mean? Women are cool. And then raising kids on top of that. Like, when did you, how long into your company did you have kids?
Gosh, I think in year 3, I had my first child. And then in 5 years, I had 3 kids back to back.
Yeah. So look, it can be done. Not easy. But like, what was that process? Like, were you raising money? Were people like commenting on it? Like, tell us about that.
Yeah. So I remember one of my VC pitches where I had crazy morning sickness. I wasn't showing yet. It was my first baby. And I remember sitting down for the pitch and putting a pile of saltine crackers next to me. Just had a little like tower of saltines. And I thought, if he doesn't ask any questions, and it's he, because I was pitching to men, but if he doesn't ask any questions, I'm not giving any answers. And the advice I had been given was, when I disclosed to the board that I was pregnant and that we had to go out and fundraise and I was going to be pregnant, they said, well, take a man with white hair with you to all your pitches, so that when you start showing, it won't feel like a bait and switch for like, as if a pregnant woman, like poof, like, like you turn into a pumpkin because you're pregnant, you can't operate a business anymore. But there was this fear that somehow, if I wasn't disclosing my pregnancy up front, that at some point it would feel like a bait and switch. So they were saying, make sure you bring a man So that at the point in time when it is just obvious to the world or you do disclose it, they'll feel like there will be a steady hand, quote unquote, behind you in the business. And so I did. And I started I always had to have a man in the room with me of a
Were they
certain age.
affiliated with the company at all, or just some
Yeah, one
random
was a
guy?
board member. Eventually we hired, a senior team that included men, and I'd always bring one to the pitch. And I just remember one of the VCs that I pitched to listened to the pitch, and then I said, "Any questions?" He turned to the man who was in the room next to me and goes, "Yeah, who are you and what are you doing here? Because she's really impressive and she doesn't need a handler or a babysitter, and it undermines her that you're sitting here." And I thought, wow, you're so right. You're so right. And it took me a little while to kind of let go. It's like Dumbo's feather, Dumbo felt like he needed to hold on to
Yeah.
it's just having a man of a certain age in the room. And by the way, it was a woman who gave me that advice. And I was like, you absolutely needed to do this. And it was hard. The other thing, and I'll just be real for a minute, when people say, can you be pregnant and fundraise? I'm like, yeah, if you don't gain weight, because every time people would comment about my pregnancy in pitches, it would be about my physical appearance. It would be, oh my God, you have a basketball belly. Oh my goodness, you look so fit. How far along are you? Oh, my wife was like huge and bloated and uncomfortable, but you look amazing. So if you can be super woman, pregnant lady pitching, you won't get judged in the same way. But that's so unfair and so ridiculous that those comments even get made. But my goodness, how many comments I fielded during my pregnancy about like how fit and tight my body was during my pregnancy. I'm like,
Oh my God.
what does this have to do with my business model?
Inappropriate.
So inappropriate, so pervasive. And I feel like they thought they were complimenting me.
Yeah.
They were trying to like say something nice. And I'm like, how about you compliment my business model, the traction, my data package, the team I've assembled, my mission, not how tight my abs are around my fetus.
Oh my God. Wait, did that one VC that called out, did he invest?
He didn't, no.
I was like, well, who is that? Give his name so everyone can call him. Amazing. Wow. So I know that I have to let you go because I know you have a crazy day, and you kind of just hit on one of the things maybe, but I'm sure you have more of this, but every podcast we ask this one question: what is the worst advice you've ever received?
Yeah, that's probably it. I think the worst advice I ever received was make sure you have a man in the room with you or else you won't be taken seriously. And I think it's just the opposite. Since I have shed this need to bring a male with me to somehow try to paper over the fact that I'm a passionate female leader, since I've shed that, I've actually become much more successful in the business mentally
Yeah.
and with fundraising. So you can do it. You can do it.
Well, also, I mean, those people are not your people, right? Why would you want somebody to invest in your company, have ownership of a company with you that doesn't believe in you? Yeah, and it's going to be harder for us until we all start making our own money and investing in women and get rid of this. I don't even want to hear about the 2% raising from ventures. And guess what? We don't need you, venture. We'll just get our own money. And, there's supposed to be this mass transition of wealth coming very soon. Well, I hope those people who get money don't just give it away to charity. They actually invest in female-founded companies.
I've said that when my company exits, I want to create a giving pledge or like an investing pledge that
Yeah.
every successful female founder who exits should allocate a certain amount of capital to pay it forward. And fund female
Look, it should
founders.
be just like what we're supposed to do. But anywhere, 10% down to charitable organizations. Why give 90% when like you could help fund and really like change the world by innovative products like yours? Although you just closed a big your last raise, right? Congratulations.
So
Amazing.
we're good. And the White House, the Biden administration, Dr. Jill Biden last week announced a big initiative for women's health funding. So the tide is turning. It's pretty cool to have been toiling in obscurity, which is ridiculous because we're half the planet, but toiling in obscurity for so many years. And it really feels like a sea change is happening right now.
Yeah, I love it.
Amazing.
So people want to learn more about you and the company. How can they do that?
Yeah, I am on Instagram. So my handle is Boss Ovary.
I know, I love it.
Patriarchy. So we got so Boss Ovary. And I try to post about our progress at work there. I think it's a good way to keep up. We keep up with our LinkedIn. We have to refresh our website. Our website's going to get a little bit more up to date now that we've closed the financing and we have some time to turn to it. But I'd say LinkedIn, follow Celmatix or me on LinkedIn, and then also my Instagram.
I love it. And wait, don't you have a book? It's going to be coming sometime soon?
Maybe, not yet.
No pressure.
No
No pressure. Yeah, not like yeah, I think you got enough on your plate. But anyway, we'll announce it when you're ready. Thank you so much for coming on. This was amazing and informative, and it's just incredible what you're doing. To everyone listening, thank you so much. This is Taking Care of Lady Business, and I'm Jennifer Justice. Thanks.
49 faces looked to him in triumph. Over the last 12 months, they had each taken turns and promoted his business for a week at a time, driving over $987,342 in revenue. What if you had a network of 50 centers of influence who promoted your business every week for a year? Grab your copy of the #1 Amazon best-selling book, The Ultimate Guide to Growing Your Business with a Podcast, at 33% off the Amazon price by going to ultimatepodcastbook.com. Again, that website for 33% off the Amazon price is ultimatepodcastbook.com.